So we're going to be talking a little bit differently, in a different lens or a different focus, and we'll talk a lot about social determinants of health and worksite wellness. So first of all, I want to ask a question to the audience. What causes heart disease? Anybody have an idea? Just yell something out for me. Yeah, inflammation, good answer. We all know, I think we all know that it's blocks coronary arteries. That would be our first given answer, I think. But what causes those arteries to become blocked? What would it be? Maybe somebody's unhealthy health choices that they make, maybe something they're eating, not eating that's correct, that they need. What about physical activity? We know that physical activity contributes to heart disease. What about tobacco use? Maybe that's the case. What about stress? Do we know that stress contributes to that, to heart disease? But I want you to go a little deeper in that thought, and I want you to say, what causes that individual to become stressed? What determines an individual's ability to be physically active? What determines and shapes an individual's ability to have access to affordable and nutritious food? I think everybody in this room knows that many people engage in unhealthy behaviors and choices. And we've known that for a long, long time. But we recently have just discovered that many of those choices and many of those behaviors are really the result of social circumstance. Maybe it's where you live. Maybe it is where you were born, you work, and where you age. The reality is that an individual's opportunity for good health begins long and long before they need any type of medical care. So I'm going to ask you one more time. What makes a person healthy? It is the absence of disease. But I would argue today that what makes a person really healthy is just what Andy was talking about. Meaningful work, secure housing, access to affordable food every day. So today when we talk about social determinants of health, you're going to hear me use the word opportunity a lot. Opportunity defined means what? A set of circumstances that makes things possible. So I know we're going to take a different approach today, but we've talked a lot about programs and well-being and those types of things, but we cannot do those things until we know who graces the doors of our organization every day, where they come from, their whole self. So let's get started. So what are social determinants of health? I'm sure that many of you know what they are. They're conditions in the environment in which we are born, we live, we work, and we play, and we age. And there's really two aspects to those conditions. There's the social. Social could be things like your income level, your education level. And then there's the physical, and that's actually going to be where you live. Do you live in a neighborhood that is safe? Am I giving a worksite wellness program to my employees that require them to walk 10,000 steps a day, and I have no idea that 90% of them live in neighborhoods where it's not safe to walk? So that's important when we start thinking about our worksite wellness programs. And as I was researching this, I found some really good aha moments for myself, and I had to choose the ones that I felt were the most impressive. But you can see here from left to right, 40% of American households are liquid asset poor. That's almost half. So you know that some of those are at your organization. And liquid asset poor means that they do not have enough money. They live paycheck to paycheck to live for 3 months to meet the basics of their household. That means paying the rent, the mortgage, getting gas in their car, all of those things. 3.6 million people cannot access medical care due to lack of transportation. So there's this thing in the United States called single car phenomenon. And so if many of your employees only have one mode of transportation, the likelihood that they need to get where they need to go is probably minimal if that one car isn't functional or somebody in the household needs to use it. And so what usually happens is medical care or medical access falls by the wayside. 15 million households are food insecure in our country. Food insecurity is a state of being in which an individual does not have access to affordable and nutritious food. They have food, but it's not nutritious and it's not affordable. We can't even begin to talk about a well-being program at an organization if individuals who are working there can't afford the food to make them healthy. 32.5 million children in the United States are living in economically insecure households. Heating and air might not be available. We know that there's an increase in childhood asthmatics as well as upper respiratory issues when children are living in these types of households. So I wouldn't say a couple, there's a lot of aha moments when we start looking at social determinants of health. On the screen is the organizing framework from the Centers for Disease Control for Healthy People 2020. Now, there are a lot of different frameworks out there, and you might be familiar with some other ones. There's one by the World Health Organization that actually has 10 areas for social determinants of health, but we're going to use this one for our conversation today, moving left to right. Well, I think I want to say one thing first. About the social determinants of health, there is a complete overlap of all of them. So what we know is that if you don't have a high school graduation, you don't graduate from high school, the likelihood that you're going to have gainful employment and make a lot of money is is a lot less than you would if you did. One of the areas that the CDC is focusing on in 2020 and beyond is increasing the graduation rates in the United States. And one thing that we can do in our well-being programs, of course, is have our own university programs. But I will say one thing, if you are going to go that route, we have one in our company, if those individuals do take those courses, there needs to be something after. Meaning if you're going to have a job board, and the job board says, needs a college degree or 2 classes in the university program that you took at our company to allow for that growth. Otherwise, it doesn't mean anything to individuals when you have those internal programs. In fact, it can be an issue for demorale, if you want to look at it that way. So anyways, on the left side, we can see employment. We see food insecurity, again, that state of being, when you don't have access to readily nutritious or affordable food, and that we can examine a little bit more. What about food desert? So if you have a high population of your individuals who live in areas that don't have access, lower socioeconomic areas, but don't have access to affordable food or nutritious food, and that's what we call food desert. On the other end of that, we're going to have a food oasis, where we have individuals in our organization that have a plethora of stores. High specialty areas, whole grain places that they can eat, complete different area, and both of those individuals work at your company. And then you have a food swamp. Now those are geographically positioned, and you might think of a restaurant row or fast food places. They're all going to be positioned in a certain place where people have access to them. I was recently talking with an employee, and they said, I really hate our health assessment, hate it. And I said, why do you hate it? I said, one of the questions is, do you eat 5 servings of fruit and vegetables every day? She said, I get my fruit and servings from Quick Trip. First of all, I don't have enough money to buy 5 servings of fruit and vegetables for my family, and Quick Trip doesn't serve enough. So, and for many of us, we don't realize that example, but there are a lot of people who come to work and that's where they go for their breakfast and for their fruit. So we looked at education, language, and literacy, and you'll see it again on healthcare and access to healthcare. Did everyone know that October is National Health Literacy Month? How many are promoting at their company? Hands. 1. So the gentleman on the first board said we've got to be good consumers of health. We can't be consumers if we don't understand what we're trying to do. So that's probably the first thing, is to improve health literacy in and at our organizations. Only 12% of Americans have a high health literacy rate. You can be literate, but you can have a very low health literacy rate. We'll talk a little bit more about that in a minute. But also social and community context, one that gets very little attention, but isolation has now been shown to increase the risk of diabetes, stroke, and heart disease by 30% more. And isolation means that an individual can't connect with their community. They don't get out, they don't vote, they don't volunteer, and they don't have that bond with the community. And at the very end is the built environment, which we mentioned a little bit ago. about children and where they work out or where they live. And sorry, if you want your people to exercise and work out, the areas that they come from doesn't always make it possible. So why are they important? How many people have ever seen this circle with that same lady's face in there? I mean, goodness, she's been around forever. I've been in work in health promotion for over 30 years. That tells you how old I am. But we've always said, if we could just get them to eat the right stuff, if we could just get them to exercise more, we wouldn't have this high cost. That's what we need to do. But what we know now is, looking at our screen with our lovely lady, that 50% of what makes those behaviors actually is social determinants of health. As health promotion individuals and workplace individuals, and leaders, we need to begin to focus on the why as to why they're not engaging. And that's where it becomes important. And you'll see that only 20% actually goes to medical care. Sometimes I think it's not about that the individual doesn't know that they need to get a preventative screening. I think that's pretty good. Sometimes I think it's not about the fact that they don't know that they need not smoke. Sometimes I think it's about social support and the logistics of finding a babysitter. Here's the good news. So what we know now is that it's beginning to take front and stage center for many of us, especially in the health promotion field. About 80% of our payers are now paying attention to how important social determinants of health are. So we know our insurance plans are working together in something called Project Link, which is a collaborative platform where they come together to solve for best practice and bring ideas together so that they can help address social determinants of health. The Blue Cross Blue Shield Association has sponsored an institute that now has social determinants of health at the center of all well-being and worksite wellness programs. And they've created like a wellness map where you can look by zip codes. I think I was chatting with Elise from Interactive Health, and we were talking about tools that we can use in order to identify areas of high density where we might, by zip code, where we might see a large incidence of diabetes and those types of things. So we can utilize those platforms that we have in order to help connect individuals with what they need at the community level. The American Medical Association is partnering with United Healthcare in order to create ICD-10 codes. So when a provider is meeting with a patient, they can ask those critical questions. Can you pay your utility bill? How hard is it for you to get to the doctor? Do you read to your child each night? Those are the questions we need to be asking as health promotion people. Not, did you eat 5 fruits and vegetables today? It's how many hours did you travel to get here to work today? 2 hours each way, and then you want me to stay and do yoga. Those are the types of things that we need to be thinking about when we start developing our worksite wellness programs. Community partnerships. I know that Blue Cross Blue Shield Association out in the Chicagoland area has a relationship with Lyft to break down those transportation barriers. They bring people to and fro from doctor's appointments, but they also deliver medications at a reduced cost so that those people can access their health care. So now I think we all understand what social determinants of health are, so let's talk about how we can apply them to our worksite wellness programs. And I'm going to talk about 4 areas. The first one, we're going to look at the individual as a whole. The second area, we're going to talk about collecting and analyzing our data properly so that we can build the right programs. And then number 3, we're going to talk about cultivating healthy workplaces. And 4, we're going to connect to our community. So like I said, the first one, we want to address the needs of the whole individual. So I think one reason many of our programs fail for engagement is because we are focusing only strictly on physical activity and weight. We've been doing it for so long, and we've forgotten that there's more to the individual. So as I mentioned, I want to talk just in 2 areas, health literacy and cultural competency. 12% of our Americans only 12% have a high literacy rate. 77 million Americans have below basic health literacy rate. Quick story, I was in the hospital. My stepfather had a heart attack many years ago. And I was in the hospital with my mother, and the cardiologist came in, and he was talking to my stepfather and my mom about what had happened. He said, yes, we've we've had this issue and he needs to do X, Y, and Z. I mean, and the one thing of course, we really want to avoid is cabbage. And he turned around and he walked out of the room. My mother looked at me and she goes, I don't know why he's talking about cabbage. We never eat that. Coronary artery bypass graft, just another way to say they had a bypass. And it might be an extreme example, but my mother is an engineer. High literacy rate, low health literacy rate. So health literacy rate has nothing to do with socioeconomic status. I was at a health fair the other day, and I was standing next to a gentleman. We were at a community health fair, and we were talking about different vendors, open enrollment, and he was giving a handout to one of the ladies there. She had been explaining that she had like upset stomach, gas, chest pain. He goes, well, the good thing about your health carrier is they're moving to an SSO, so you can get on there, search for a PCP, and find somebody to help you with your GERD. And she stood there and said, okay. So the very first thing that we need to do is in order to help our people understand what those things mean so that we can be effective in those types of ways. What do we need to do in our programming? Infographics for Worksite Wellness. Know when to go to the ER and know when to go to the urgent treatment care. I have the flu, I have the plague. So you can use pictures to certainly help individuals understand what it is you want them to do. The World Health Organization ran many studies and said this was the #1 way to impact employee engagement in health and well-being through infographics. 4th grade reading level. I just read something also that we need to go to 3rd grade. And that's not necessarily because we want to demean anything, but we have a lot of words that we use that we want to explain and make sure that people understand when we start talking about our health and our health communication. Going along with that is our cultural competency. We have a lot of maybe different types of cultures, multi-generations. There's a great program that I want to listen to later today about how we communicate. But then being culturally relevant, high Latino populations, female, or you might have Native American individuals. You want to be sure that you're communicating at all levels with all of those individuals. Some of the things that we want to think about are designing programs that are inclusive, but we also want to think about resiliency training at the underpinnings of all social determinants of health. I only threw financial literacy in there because we talked about the economic stability as the first social determinant of health. For providing financial literacy programs at the workplace is very important for those people to understand how to create a budget, for everybody to understand how to create a budget. 40% of Americans are liquid asset poor. We spend over half of our lifetime at work. Somebody said it's our responsibility as employers to help our employees. Forget physical activity, forget weight and nutrition. Let's talk about the things that are going to change lives. We have one organization I work with has on-site cultural brokers. This is a great program. We all have wellness ambassadors and wellness champions, but on-site cultural brokers can bridge the gap. So they can help with communication, and they can help people understand their benefits, and they can certainly help bridge any type of cultural gap that might exist. So the second area is we want to collect and use our data effectively. Everybody has a lot of data. Yes, raise your hand if you have any data at your organization. Because sometimes it makes you crazy. But a ton of data that we can be using to understand our organization better outside of the pieces that are pretty obvious. So the first one that I like is the county health ranking data. If you are a wellness professional at an organization, you need to be looking at this data because it'll tell you a couple things. Number one, it'll tell you median household income. You can know your organization is 80% female, 20% male, but you need to know the transportation barriers. It'll tell you by zip code where your people are coming from. You can find out that they are commuting an hour each way. We're going to talk a little bit about incentive design, but this just jumped in my head because I was working with a company about a year and a half ago, and they were doing an incentive design around biometric screenings. Everybody does biometric screenings. And so they said, you know, we're not going to bring them on site anymore. We can't afford to let people off the clock to get it done. We have to have another solution. So we're going to give everybody vouchers. And you know what? They can go to a lab and get it done. This is going to be easy for them. This is a customer service center, high female, 20% male, 80% women. They worked 7 to 6 p.m. The average person, when I did the county health ranking data, the average woman traveled 1 hour each way from rural areas of this part of the country, usually by public transportation, single-parent family, mother was the leader of the household. Now, the lowest engagement they probably would have had in the biometric screening, we went to the individuals and we talked to them, why didn't you do the screening? Why didn't you do the incentive design? You know what? You get a premium reduction. You have 2 kids at home. You need this. Yes, I do need this. But the lab is open only till 6 p.m. I commute an hour each way. I have 2 kids. I can't afford a babysitter. And on Saturday, we have 1 car. And there are other things that I need to do, and yes, I do need this premium. Why can't you help me? So we need to think about that when we put together our designs. We forget that we're talking about those human beings that come to our organization every day. So the CDC has a great platform as well. It has a host of community resources that you can connect your employees to every single day, and it keeps rotating and updating every single month with new and things that you can bring into your organization to help your employees. We have the Blue Cross Blue Shield Index that's utilizing the zip code. It gives you a wellness map, a snapshot of your employees, your median household income, those types of things, so you can see that. And it also tells you the incidence of diabetes might be in a zip code area, where there might be issues of heart disease and those types of things, so you can start planning your programs appropriately. If you know that you have a lot of employees coming from an area that has hypertension or high blood pressure area, and then you're looking at your medical claims right across there, and you're marrying the two, and you're saying yes, or your pharmacy claims, we're looking at our pharmacy claims, and we're seeing a lot of hypertensive individuals. And they're traveling all this way, and they live in this area where there's high heart disease and hypertension. What can we do? What program should I create? Maybe look at your vending. Have a lot of salt in your vending? Can you do something about the sodium intake for your employees? Because obviously this is contributing to your hypertension. Those are the types of things that we need to strategically think about when we talk about worksite wellness. And so we're looking at our claims, we're looking at our medical, we're identifying those high individuals maybe that are using the ER over an urgent treatment center or vice versa, and not having an established relationship with their primary care, and they're high risk, they're going to be a higher cost claim for us. We need to talk with those individuals, we need to meet with them and connect them to community resources and educate them. Bring in your cultural on-site brokers to help them understand. Every company usually has some type of coaching program out there. They can use clinicians, they can use coaches, whatever the fact may be, but this is the best place to integrate questions for social determinants of health. So those one-on-one discussions that those coaches have, as Andy was talking about when she was even meeting in her leadership or her coaching conversations for advancement or career advancement, you need to ask those social determinants of health questions, just as I said. Do you have transportation issues? Are you able to pay your bills? Do you read to your child every night? Because those questions can help you understand and shape your programs, just like they should be included in your health assessment. Rather than saying, do you eat 5 fruit and vegetables every day? Do you have access to fruit and vegetables? Should be the question. And then if the question is, no, I don't, then you know what kind of programs you need to start creating. Are you able to walk in your neighborhood? If the question is no, then what can I do as an employer to allow for physical activity at my workspace? Is there something that I can do, a program that I can do on work time that's going to allow my employees to do that? We talked a little bit about incentive designs, and we could talk all day about the best type of incentives to create, but we really want to be sure that our incentive designs align with our population. And I will say, after 34 years in the field, we are so off the mark on incentive designs, focusing in too much on outcomes-based programs of BMI, HDL, LDL. So we really need to start rethinking how we design those programs in order to improve our employees and to help to empower them. So maybe it is about doing a resiliency program for them. Maybe that's where it is. If an individual you do have financial literacy classes and they do create a budget, maybe that's the incentive. Stop getting out of the physical activity and the weight management areas. We certainly want to cultivate healthy employees and work sites. So we want to promote those growth opportunities. I'm all for it. Have education at the workplace where people can get the means to move up or to get a better paying job, to change their income and their status. But again, you need to have something on the end that allows them to do that. So if they take that certification program that you've put in place, like we have a Blue University, there better be a result for that on the back end. Not that I gave my time to get this certification at work, but now I do have the opportunity to get a better job. Reward and recognize, promote autonomy in the job, in the workplace, allowing people to make some decisions about their own success. Champions and ambassadors, we talk about cultural brokers, and we want to support and promote work-life balance in the workplace. We want to train our mid-managers to recognize social determinants of health, and this is built into your programs, just like mid-management performance. So, do they recognize when an individual is struggling, and how can they intervene and help? We had metrics into our mid-management training many years ago at our organization, where individuals had to do certain things around wellness and well-being. And we had the most engagement at that time with our employees because we had our buy-in from our leadership. I know it pushed them a little bit because it was part of their performance metrics, but it was also a good thing because we drew that connection with our midline managers and our employees. And so they felt very supportive. So what about flex work from home options? I know working from home is not always an option for everyone, but it certainly is something that organizations are beginning to think about, and it's good for flexing, maybe not all the time, not every day, but some. What about PTO? So I was having a conversation with one of our wellness consultants, and they were talking about some PTO frameworks that they had in an organization, and they're only allowed to take 8 hours of PTO, the employees. So this would truly impact their ability for medical care or if they have to go to the doctor. So of course, 4 hours is good. What about 2? What about any? Can you just take what you need? So those are types of things that you want to start thinking about when you look at your policies. Organizations can certainly side with other groups to allow people to have groceries brought to the work site. So I was working with a company many years ago, and this was really revolutionary at the time. They were actually bringing in vendors who would bring the groceries there. The individuals could purchase it, and then that would decrease that transportation. They would have the groceries there, and then they could take it and go from there and go home. So it was really beneficial. We have things where they offer food at the workplace, and we've seen vending machines things, and you can do you can set up your cafeterias where you can certainly make people aware of what's inside the food, but offering more fruits and vegetables. There was one company that we worked with where they were telling us about Fresh Fruit Fridays. Every Friday they would have fresh fruit at the front of their company, and they would bag it. Nothing was over 25 cents, 50 cents maybe. They started at 8 a.m., and by 10 a.m. everything was gone. So obviously the employees needed that and wanted that. And this was a very large corporation, so I think that was a very good idea in order to make that accessible. Daycare alternatives. This is a really touchy one, but we've seen organizations move towards more of a daycare on site that would help parents. It would also help achieve the work site and well-being programs that you put in place if we have daycare alternatives available. I think the last one is so important, that we address stress at the workplace. How many people here have any stress? So there's a great book out by Jeffrey Pfeffer. Has anybody ever heard of him? Dying for a Paycheck is the title of the book. He's out of Stanford, and he talks a lot about employees and chronic disease, and how chronic disease, the root of that is at stress, and the root of that stress, of course, is work, and how we as employers can help minimize that. So there's things that we can do in the environment at work as well. So things like reboot rooms, again, resiliency training, surveying our employees where they actually work and what we can change in the dynamic, whether it's lighting, it could be heating and air, it could be anything that contributes to the environment that they work in. Support groups. How many people have support groups at their organization now? Anybody? So we talk a lot about support groups, but we never have them. We do have online type support groups, but really bringing it to the people, allowing to create those support groups have been very, very beneficial. It's for transparency and understanding, so really to address those. And employee assistance programs. Don't leverage those like we used to, or we should. EAPs are probably one. Everybody has an EAP, but some of the most underutilized ever. EAPs can do a lot of things for us. You'll see on the far side there, this is our fourth area, connecting to our community. If you are a worksite wellness professional and you are not leveraging your community resources, you are doing a disservice to your employees. I'll start at the bottom since I just mentioned employee assistance programs, but job training, they can do a host of things. You could build an entire worksite wellness program just off of your community connections. They can help with substance abuse training, affordable housing, connecting healthy neighborhoods, those types of things. Your EAP is a wonderful resource to use. Food banks and pantries, so charitable organizations. One of the organizations that I work with in Oklahoma City, they sponsor a food pantry. It's completely free in a lower socioeconomic area. They have their wellness champions go out and stock it. Every other week they go out and they put it in there. Every day they come back, it's completely empty. And they stock it with diapers, they stock it with all kinds of things, completely empty. It's open and you can go and take what you need. But organizations are starting to work in that area. And I will say one thing that does work towards our favor with social determinants and building them into our worksite wellness programs is how our employees do like to volunteer. And that does bring a lot of autonomy to their roles and empowerment to their roles to volunteer and help in the community, and then help with their employees themselves. So our community clinics, free screenings, immunizations, those things that we want to use, mobile vans if you have the opportunity, get those involved with you, local fitness facilities, churches, the American Diabetes Association, if you do not know about this as a worksite wellness person, they're bringing their programs to the neighborhoods, to the churches. You can call the American Diabetes Association and they will set up preventative programs in a neighborhood if you ask them. You have enough people to go, you can have diabetes awareness in an area that would reduce that transportation barrier, completely break it down. And farmers markets, you should be bringing those into your organizations, making them available for people to buy those fresh fruits and those vegetables and those types of things. 40% of Americans, or what were that, are liquid acid poor, but how many of them were food insecure? 15 million are food insecure. Those are the people that come to your offices every day. Do you know who they are? So I know I want to close and I want to leave a couple minutes for questions or thoughts. Maybe you're doing something at your workplace around social determinants of health and building some creative programs. But about I don't want to date myself here, but in late 1980s, after I graduated from college, I was working downtown in Houston, Texas. That's where I'm from. And I was teaching aerobics down there part-time during lunch because I was working for South Texas College of Law. And I was teaching at the Tenneco building. I don't know if any of you are familiar or even old enough to remember the Tenneco project in Houston, Texas. It was one of the most impressive fitness facilities, employment fitness facilities in the world. A gentleman named James Kettleson built it. It was on the Tenneco 1010 garage, floors 8 and 9. Now this was like the late 70s. He had a heart attack in 1979, so he built this. It was so impressive. It was free to any employee at Tenneco. And any employee could go at any time. It was flex. 1980. All you had to do was back in. Not only that, but you shorts, all folded on each side for female and male. You walked in, everybody wore the same color. Gray shorts, blue top, white socks. I went to aerobics, doing a grapevine. We all looked the same. It was a massive and impressive place, and when you used it, you could get incentive points, and he had a beautiful cafeteria for the employees, and then worked there and then redeem that for fresh food. It was amazing. Let's fast forward 22 years. I'm visiting Katy, Texas, and she takes me to her fitness facility on I-10, and I'm in the locker room to take a spin class, and there's a woman in there. She's getting ready to leave. She has a bag on her bench there, dark blue, old canvas by Wilson duffel bag, and it says Tenneco Fitness. And it's old because it's stitched up on the sides. It's got a patch on one end, shoes sticking out a corner, but it was old. And I said, "Did you work at Tenneco?" And she goes, "Yeah, I did." I said, "Oh, I taught aerobics there," and we chit-chatted a little bit. She said, "Best place to work." She said, "I never exercised a day in my life." She said, "Then I started working at Tenneco." She goes, "And I started going to exercise every day for 30 minutes. I didn't even have to bring my own clothes. They were there for me, my towels." She goes, "Then I go get some nutritious lunch, and I go back to my desk, and I would then get to go home at a regular time." She goes, "I was a single mom, parent of 2, lived on the outside of Houston, couldn't afford to live inside the inner loop because it was too expensive, and the areas I could afford were too unsafe for my children." So she took the park and ride in every day. She exercised every day. I said, "That's so amazing." I said, "And I can't believe you still have that bag." She says, "You know I do." She picked that bag up, and as she was walking out the door, she turned around to me and she gave me the biggest smile I'd ever seen. She goes, "I'm going to be 70 in a couple years, and I'm still doing this. This bag changed my life." And she turned around and walked out. You all have the opportunity to change someone's life. But you can't do it unless you create the right program. You have to know who's coming through your door every day. You can't do it without knowing that. Opportunity is defined as a set of circumstances that make something happen, and you have the power to do that. So I want to thank you all for listening. Does anybody have any thoughts, questions, or concerns? Anything they want to share? Social determinants of health at your organization? Platforms you're using? Anything? I don't get one question. Thoughts? Just an idea? All right. Done. Okay.